This is, I always, we're now live. Hi, everybody. It's Wednesday, the 23rd of April, and it's a pleasure to be here with somebody else. Mahesh is well known to all of you, has written incredible articles on physics and radiation dose and everything that affects CT and beyond CT scanning. He has a number of titles and appointments, but I won't go through that. We were sitting here talking. There's an article some of you may have seen, though probably most of you haven't seen. It was one of in the medical journals about a week and a half ago, about an article that we seem to see about every decade or so, about how radiation, from CT specifically, is causing cancers. And this article kind of inferred that 5% of cancers was going to be caused by CT. Now, I think the good news a little bit is that unlike 20 years ago or 25 years ago when the articles came out, I was getting 100 phone calls a day and people were doing, and there was the news, nothing. On the other hand, I think it's our job to answer the question, does this article, what is the truth? Is this article true? What's the problems with the article? We all know that we need to be doing the lowest dose possible. We all know, as radiologists and technologists and physicists, we need to do the best scans possible to make the diagnosis, the right diagnosis on every patient we scan. So we all understand that. On CTisus, we speak about protocols, we speak about how to read the studies, how not to miss things. We're working on AI now to not miss small lesions like pancreatic tumors. But radiation is something that's always been there since the beginning of radiology, right? But when these things can come up, I think it's an opportunity for all of us to rethink what we know. And if patients ask us questions or friends ask us questions, or just to update what we should know. And so no one's better than Mahesh to tell you what you need to know. Mahesh, thanks.
Thank you, Elliot. I think this is important. As you said, there was a lot more concern 20 years ago when one of the other papers came in 2008, and rightly so. But now what we have seen is like the authors have used the same model and shown the numbers through the number of CTs done in the annual, and they come up with this statistical model number estimation that future there will be 5% of all cancer will be caused by CT. There's nothing new about the model or the estimation, but what concerns is like the authors never talked about all the efforts being done in the past 20 years regarding how much things have changed in CT and why we are doing so many CTs, because there is a lot of benefits people are seeing out of the CT, and that is not discussed in this paper. So when you say 5% of all future cancers are from CT, the question comes out, how many cancers have been saved because of CT? That's not discussed. In addition, there is a lot of things have happened in the last 20 years, and we have shown in not only national report and also international report, the overall dose per CT exams are going down because of the technological advances. Second thing is the way we are working as a team between the radiologist, physicist, and technologists to optimize the protocol. And we have better way to justify each of the procedures. So because of those things, the amount of CTs, number of the radiation dose from these CTs have come down. As you know, probably the best classic example is cardiac CT. When we started in 2004 or 2005, when you're doing cardiac CT angiography as retrospective CT gated, it was a high dose procedure. Now with the advanced scanner, dual source CT or with the wide detector CT, we are doing the same CT angiography almost close to 1 millisievert, almost 10 times lower, but that's not accounted here. When these type of studies comes out, it is very eye-catching headlines. The eye-catching headlines, the people in a field knows what that limitation of the study and other things, but general public do not know. I think that's where we want to convey this conversation, to tell it like, we are doing much better CT, and we also know that CTs are providing a lot of useful information to diagnose a particular ailment and follow the treatment. So that needs to be balanced in this particular study, which is not done here.
Right, and then, as you mentioned, the technology is changing things like photon CT, which is, yes, it's only in a few places right now, but at RSNA this year, one of the major vendors
Yeah.
introduced a lot of cheaper
Yes.
versions,
Yes.
and every vendor from GE to
Yes.
Philips to Canon are all coming out with these newer scanners
Yeah.
over the next couple of years that have better dose profiles.
I completely agree. That is one end, the photon counting CTs, which is really exciting thing. But even with the existing advanced CT scanner, the radiation dose modulation technique now probably it's de facto standard with all the scanners we do. Whether you do it in an advanced academic center or in a clinic, once you turn on this automatic dose modulation, it has tremendously decreased the radiation per person. That needs to be accounted. And for example, probably at the how many number of times we are now limiting, we are no longer doing CT, chest CT with and without contrast. We have changed the practice. Only most majority we only do with contrast. So there is a lot of things have happened in the past 20 years. We need that to be discussed in balance to what this particular item they want to discuss. I agree. We need to discuss more. We need to have a continuous awareness about the justification and optimization CT. On the other hand, just caring, telling like, oh my God, we do so many CTs. That's the future CT. Now there will be a lot of cancer. In fact, yesterday the Cancer Institute put out an annual report for 2025, and it is kind of nice to see the number of cancers in the U.S. is decreasing further down by 1.8% in 2025 for both male and female. So those things are happening. So we need to provide a well-balanced approach. That is very important when these type of studies when it comes out.
Right, and even things like pancreatic cysts, where now if a lot of the recommendations are to follow those patients, well, we follow them typically with MR
Yes.
and not with CT. But also, I think, everything is a risk reward. That's life. That's going in the car
Sure.
to drive to the hospital or to
yeah.
the medical center.
Yeah.
It's always that risk reward. But the point being that there's so much information. You mentioned about cardiac CT.
Yes.
Now the appreciation for calcium scoring, which we've been doing for 2 decades,
Yes.
but now is like a mandatory thing because it's the best factor to predict outcome, to predict whether you should go on different meds or not. The ability to look for GI bleeding, CT, the ability to detect tumors earlier. One of the things is AI, right?
Yeah.
AI is increasing our ability to detect disease earlier, which means managing disease earlier.
Yes.
Most cancers, the earlier the stage at detection, the better the outcome.
Yes.
So, we are picking up cancers earlier. You look at the survival curves for cancer.
Yes.
Obviously, there's new medications, there's new therapies. Immune therapy is a good example. But so much of it is early detection of disease, the ability to monitor response to therapy. And then with AI coming in to help us do everything better, which potentially also will help decrease the dose of scans as it's built into the factors and customizing the scans for individual patients. So I think, kind of like what you said, and I think you need to always think about everything and get away from the headlines. I think these days, with politics, everything is headlines.
Exactly.
People,
Yeah.
But I was pleased. I do remember that first article you mentioned in 2008.
Yeah.
What people may not remember, that was during RSNA. It was published in the New England
I know.
Journal of Medicine.
Yeah.
We're all at RSNA. You couldn't even answer.
Exactly.
Everybody-
And even then, at that New England Journal article was I know the author, one of my good friend. They did a back of the envelope calculation and told 30% of scans are wasted. And that number has got stuck in the media. They keep still using the same thing. It is not fair. In addition, a lot of things have happened. Plus, we also need to awareness some of the usefulness which came out from the early 20 years ago study is we have paid now more attention for image, like optimization, the teamwork of protocol reviews, and we also making sure we are working as a team. Plus, the vendors are working at creating these new technologies. As you said, the photon counting CT is going to further able to enable us to lower the radiation dose per CT and still get the good quality images.
Right.
So those are happening, and we need to appreciate that.
Right, you think about the things screening, low
Yeah.
dose CT for lung cancer
Exactly.
screening, saving thousands of lives a year.
Yep.
Many of the things we're able to do with CT and just the information from a scan, the ability to look for osteoporosis, coronary scoring, vascular mapping, sarcopenia, and early detection of disease.
Yeah.
I think that you have to be careful. I think it's like anything else. It's kind of headlines, 145% tariff on China. I don't want to get into tariffs. I don't know much about tariffs since I left sixth grade.
But it's going to affect us also.
But it's
because
a lot of, you can't get contrast. Won't get contrast.
Exactly, the contrast will be expensive. Now even the X-ray tube, which we're going to manufacture, is going to be expensive because the materials are coming from China. So again, what I just is.
But I do believe if we speak here 2 months from now, the U.S.-China issues will be solved.
I think so. I
I think
yes.
both parties are smart enough.
They know.
After you get past the noise, to realize we need each other, and it's a world where everybody could benefit. And
But I want to add one more thing. It's kind of interesting because we did a study, national study back in 2008 when you were, and at the same time we also did a United Nations global surveys. At that time, I look at the data, the number of CT done in the US was about 62 or 68 million. That occupied almost more than 30% of all the CTs done in the worldwide. Now we updated after 10 years another report from United States and also global. And the global number now shows it is now we are doing about 400 million worldwide. With now, even though we are doing 93 in the US, that only occupies a smaller segment, 18% of the global CT. What does it tell? Basically, it's like there's a hunger for quick diagnosis, good treatment, and it is a number of CT scan is increasing worldwide. And in fact, what we are doing here are in the early stages where we are optimizing this protocol is getting scaled up worldwide. So that needs to be recognized also.
Right. But I think the only positive I could say about the article is more in theory. There was nothing positive at all. The same people writing the same article over and over again.
Exactly.
Not even in a radiology journal because it probably wouldn't be accepted there. But I think the important thing is that it reminds us that you, me, everybody, every one of us, at our own institutions, outpatient centers, hospitals, needs to make sure your protocols are updated.
Exactly.
They're done at the lowest dose possible, not such a low dose that you can't read the study.
Exactly.
But remember, we always make the point that the way you decrease dose is do the study right the first time.
Exactly, I agree.
And so you don't have to repeat it over again. So I think it's a little bit just, I won't say a wake-up call, it's just more a reminder, which we always do, is be able to make sure you're doing everything correctly.
That's correct, but only thing sometimes it bothers me with these type of headline catching article is it has unintended consequences.
Right.
Some regulator sitting somewhere in a country, he or she doesn't know the detail, they can put a kibosh on the number of CT scans done.
Right.
Oh my God, this is too much. I have an obligation to protect my citizen. Let me cut off and they will have lot more unintended consequence. People getting a CT, there is a discussion about should we track patient doses, cumulative dose.
Right.
Even that has an unintended consequence. But then insurance company can deny a person because based on some arbitrary number, and that doesn't serve well for the whole patient healthcare.
That's a good point. And also, the other thing is, you have people who are smokers.
Yes.
So the recommendation, lung cancer screening saved lives.
Yeah.
People who smoke, I did this, we were one of the 3 largest recruiters in the initial study, but people who smoke feel guilty that they smoke, because everyone knows you're not supposed to smoke, okay? Even if you're smoking, whatever you're smoking, you're not supposed to, okay? It's not healthy for you. Okay, we're not going to argue that. No one's going to argue that. The tobacco companies are not going to argue that. But I think people who smoked are afraid to go for a study.
Exactly.
And so now they say, well, I'm not going to go for a study because I'm going to get radiation dose. And then the radiation dose, which will do nothing to them.
Yeah.
On the other hand, you missed a 1 centimeter of cancer is in their chest.
Yes.
That could be taken out and they could be cured. Instead, they're going to show up 3.5 years from now with liver mets, bone mets, and be unresectable with stage 4 disease.
And that is very true because we know that lung cancer screening has a lower uptake because of this stigma attached. And now we are adding another point to them, telling oh, why do I get it? Because I'm going to get more cancer because of this radiation, which is not true. Again, the author kind of hinted that this 5% for future cancer is almost same as obesity and other things, 5% rate in the US. That is not right to compare
Right.
this one. It's like remarkably not fair to compare these things based on a statistical model without understanding, recognizing the benefit these scans have done.
Right. And also, you know, if you think about it, have you ever seen a lawsuit or anything else talk about we're suing because the patient got cancer from getting a CT scan? The answer is no. This is all extrapolated data,
Yeah.
making a lot of assumptions and then coming to an conclusion based on a bunch of assumptions which are in and of themselves not true either.
Exactly, because in fact, if you read the article more carefully, I see that they have used, the authors have used like estimation about 50 times.
Right.
So means there is so much uncertainty, but nuances is when it played on 11 o'clock night news of 2 minutes, 5% for future cancer, immediately everybody like, oh my god, I don't want to get my CT done. And that is what I think we both are trying to address and clarify these limitations. One other thing which I want to tell you is like I kind of like it. As you know, nowadays the cardiac CT and geography has grown up so well. A person coming in the emergency room, if they can get a good cardiac CT and geography done, and if it is negative, the cardiologists are comfortable to send them home rather than sending them to exploratory surgery or cath lab.
Right.
Imagine the downstream saving of economy plus the concern of the patient. These are the benefit of the CT which need to be highlighted. And I agree, we have to continuously talk with, like we cannot just forget about it, but we don't need to create fear in the people. That's why.
Great. Now, you wrote something about this recently that you published.
Yes, and again with the American Association of Physicists in Medicine and the American College of Radiology put out immediately a press release responding to this particular article, telling like there is not more nuances to this article. We also wanted to highlight that this is a statistically calculated model, and there's nothing new with the estimation way they are done. And again, they had done it's kind of interesting. The authors had done more detail about 120,000 data point or something, but the way it conveys that they did detailed study of all the 93 million, not necessarily because they are kind of scaled it up to 93 million studies numbers coming out from the national surveys. Yeah.
But so I think we posted it, Lily posted
Yes,
it on CTisus,
yes.
and Lily will post it again so you can read it, but it's on Facebook and it's also on the website.
Yeah.
It's worthwhile reading because it'll also help you think about it. And if you have any questions, you can send a note to Mahesh.
Sure, I would be
Okay?
happy to. And again, this conversation is really helpful because I know I've done a couple of podcasts last 2 days, but I think we need to reach out to our listeners and users so that they should not be confused.
Right.
Because that's important. Thank you for doing this one with
Okay,
me.
my pleasure. Thank you for doing it.
Yes.
Okay, everybody, we'll
Thank
see you next week. Have a great day, everybody.
That was so good. Thank you.